Hi, everyone. It's Leanne West, and I'm president of the International Children's Advisory Network. I just want to welcome you today to Ask the Experts with Anthony Chang.
Today, we're going to be talking about what it means to be rare in the world of pediatric rare conditions. And we have luckily with us today, Rhiannon Perry, who is our expert in guiding us with her personal story and her journey. And we will be hosted today by Dr. Anthony Chang, who comes with lots of experience with all kinds of kiddos and dealing with lots of conditions and a great perspective of a doctor. So I'm going to turn it over to Dr. Chang to introduce himself, and then we'll go around and make sure that everybody has a chance to say who they are and where they're from.
Hi, good morning, everyone. First of all, it's just serendipity that I just got off a call with an effort trying to be proactive about rare diseases. So this is like Rare Disease Day for me. Just some factoids about rare diseases that maybe not everyone's aware of, but there's something like more than 10,000 probably rare diseases, and probably a lot more because by definition, if it doesn't occur very commonly, maybe we don't know enough about it to make the diagnosis. So if you think about the impact on, let's just the US, is everyone from the US here? No?
I believe Valeria, she is not from the US. Valeria, do you want to unmute and say where you're from?
Are you from Italy?
I'm from Italy.
Italy, yeah. So, by the way, I'm good friends with people at Bambino Gesù. Are you in Rome by any chance? Where are you, Valeria? Valeria, what city are you from?
Valeria, do you want to unmute and say what town you live in?
Are you from the little town called Rome by any chance? Because I'm good friends with a lot of doctors at Bambino Gesù in Rome. As a matter of fact, I'm visiting them this summer, hopefully.
She's typing, so we might see a message here in a second.
Okay. In either case, probably, roughly speaking, about 1 out of 10 people, which is a lot of people, have a rare disease or unusual manifestation of a common disease. So I think we don't talk about that so much, but if you have diabetes and you have a very unusual presentation, in a way that's in the category of a rare disease because you have such a rare common, rare symptom of a disease. So in other words, you're hard to diagnose. So that's probably in the US, 30 million Americans, believe it or not, probably have a rare disease or rare symptom of a common disease. And the tough part is we often don't make the diagnosis in a timely fashion, and we sometimes take years or even decades. Can you imagine have a disease and you don't know about for decades of your life, and sometimes die with the rare disease that no one figured out? So we really, really, really need to work hard on diagnosing diseases, because the earlier we diagnose these rare diseases, the better chance we're going to have of treating this disease. And we already have a big handicap with rare diseases because something like 90% of rare diseases do not have an FDA approved therapy. So, and partly because we don't make the diagnosis in a timely fashion and we don't have a therapy ready. So it's like a vicious cycle working against us. Because we don't make the diagnoses in a timely fashion, then we don't get to think about therapy. And then if we don't think about therapy, we don't have enough patients with experiences with the therapy to make a difference. So the whole thing is just working against us. So that's why I'm personally very, as you can tell, very passionate about rare diseases. And I'm trying to think of using artificial intelligence to really make this easier for everyone. So that's ironically the last hour I was just working on that. So by using artificial intelligence, I mean, there are certain conditions that have very characteristic findings and no one able to figure it out. But if we take those 1, 2, or 3 elements and put it together and have a bot that's going to go through medical records looking for similar patients, that's what I'm doing. So I think it'll be really cool to say, no one figured you out, your child out in terms of rare disease, but this is what we think he or she has based on the key findings that you can basically, it's like a mini search engine looking for patients with rare diseases. So we're proactive rather than reactive, right? So I'm very excited about that project. It's kind of like being a Sherlock Holmes. So we actually call that project Enola after Enola Holmes. So being a detective. So I'm very excited about that project. So, all right. So in a nutshell, that's rare diseases. It's kind of a paradox, right? Because rare diseases actually are a lot more common than we think because of the number of rare diseases, probably well over 10,000, maybe more, and affects many more lives than we think. Because we think of rare diseases, we say, oh, it's probably 1 in a million that have a rare disease. Well, that's not true. It's because there's so many rare diseases that maybe 10% of the population have some rare disorder, rare disease, or unusual manifestation of a common disease, which I always put in the same category. So it's probably 1 out of 10 rather than 1 in a million. I think that's probably the biggest misconception, is that rare diseases are rare, so it's not many people affected, so why bother putting resources into rare diseases? But in fact, it's probably 5 to 10% of any population. Does that make sense? Anyone with any questions?
I think that's a really good segue to have some of our other guests kind of jump in with a little bit of their story. And I want to end with Rhiannon, because I would love to focus and have her share a little bit about what she's gone through in her journey. So you all know me. I'm Amy Omer. I'm the director of the International Children's Advisory Network, and I'm so glad to see you all here today. We are focusing on what it means to be rare. So if you just joined us, that's going to be our conversation. And Dr. Chang just gave us a really great intro into being a detective and searching to find the answers for these smaller population groups, but really are a larger population group when looked at as a whole. So I think that's a really key point that Dr. Chang just made. I'm going to send it next to Claire. And Claire, if you can call in the next person after you're done, that would be great.
Perfect. Hi, everybody. My name is Claire Strump. I'm iCAN's Associate Specialist. So I work with Amy on all of our projects, and especially ones like Ask the Experts today. So we're so happy to have all of you. And I have a little bit of experience with rare conditions. I don't know if mine was still considered rare or not, but it was an interesting experience, especially having to really do a deep dive on research and trying to figure out what the best solutions were for it. So I have a little bit of experience, but I know there's lots of our youth members who have a little bit better of one or a little better description of one. But I think I'll go next to Valeria, if you would like to talk a little bit about who you are and what it means to have a rare condition.
Hi, Valeria. I'm 17, but I'll be 18 between a few days. I know what this is like with rare disease because I have a rare genetic disease that is called the Miser-Sardino, and that disease includes many organs like eyes, because, for example, I live with retinitis pigmentosa, that it is so when it is dark or it is evening, I can see very well because some parts of my eyes doesn't work very well. So I didn't see what where I am at that moment. So if I am out, I need a person who helps me to find a way to go in another room. But if I am at home, I know because I do this every night or every evening, but also I understand very well the people who have ISIS diseases, because when you have a problem with organ like a sense organ, the others they increase very well. So, for example, when I can see, I just I need just to touch something to understand where I am and to know how to move myself. Then also it includes some bones, like for example, I have my pinky of my left hand that I have operated 2 times because I have a bone plus that there is, so I operate it for have it like the other pinky. Then it includes also kidneys, because I have also problems with this, and during this year, exactly on the 10th of October, I have transplanted of a kidney, so I live with this new kidney. Then includes also liver, and that's all where I want to remember.
Thank
Perfect.
you, Valeria. I think that's just so incredible that your other senses are heightened when your vision is affected. And I think that's really neat how your body has this extra superpower in being able to help you navigate a little bit. That's really incredible. And I think some of the other kids will probably be able to relate to that too. How one part might not be, performing in the way that we want, but there's these ways that our bodies learn to compensate a little bit to work around that. It's really, really helpful and interesting to know. The next person, Mary Claire, did you want to go next? Or maybe Mary Rose, did you want to go?
Yeah, sure. What am I saying again?
We're just saying who we are today, and if you have any experience that you wanted to talk about with rare condition, that would be great.
Hi, I'm Mary Rose. I'm from Kids UP, and I don't know about rare diseases, but I feel like rare diseases can be different in like different places. So like where I live, maybe Lyme disease is extremely common, but I was from Florida originally and nobody ever got Lyme here.
Yes, that is really true that certain parts of the country have more propensity to have diagnosis of one kind or another. So I think you're right. That's a really great perspective to bring to today's discussion. Karen, did you want to go next?
Hi, all. Good to be here. And I really got more sensitized, I guess, to rare diseases. I had a childhood illness that brought me into Minneapolis Children's Hospital when I was a kid. I don't know if it was rare exactly, but as I've been learning about rare diseases, something recently that I attended, it was through a pediatric showcase. And I had no idea that this experience happened for little ones that were born without being able to use their arms or hands. And someone from Minnesota, a CEO who had been at Medtronic, moved to become a CEO of this company. And it's this, Dr. Chang would know better how you say it, exegesis, or how would you say that phrase, where it's this this mechanized suit almost that you wear. Do you know what I'm talking about? Oh, we can't hear you.
An exoskeleton?
Yes, yeah. And you put it around the arms, and this child was able to pick up a cup and color. And, it just floored me to think about this kind of thing. So I've just been learning a lot about and have incredible admiration. And I was supposed to attend this big event at the State House for rare diseases in Massachusetts, but some things came up that I wasn't able to go. So I wanted to keep understanding and learning, from this community. I have one quick question, if I may. When you have a rare disease, when is it useful to tell people when you're in public spaces or school or whatever that you have something? And when is it appropriate not to share? I guess if anybody has a thought on that.
Yeah, I think that's a great question. We'll get to Reese and have her introduce, and then Rhiannon, maybe you could take that as a good segue into what you're going to be sharing. I think that's a really key point for learning for all of us.
Absolutely.
So
Yeah.
we'll do Reese introduction first, and then we'll go over to Rhiannon. Reese.
Hi, my name is Reese. I'm currently at work, so if my background noise is a little bit loud, I apologize. I can't totally tell. So I personally don't live with a rare disease. I live with type 1 diabetes, which is pretty common. Diabetes is one of the most common diseases in the US right now. With that being said, my little sister does have multiple rare diagnoses. And so I think my perspective is best encompassed through her experiences and trying to understand her perspective on things. And I also, through iCAN, I've met so many people that have had such complex diagnoses as well. So it's been very enlightening to get to know everyone and how their own health journeys have kind of affected their lives. And I find all of it to be incredibly interesting. With the added bonus that I do live with something, even if it's not rare, I kind of understand where they may be coming from with certain things. So I'm so excited to be here for this week. This whole topic sounds extremely interesting. So looking forward.
Thank you. And Rhiannon, so we would love to hear a little bit about you and your journey with rare. And, maybe you can add in Kieran's question, like, when do you tell somebody about what you've been diagnosed with, if at all, or, how you feel about that?
Yeah. So my name is Rhiannon Perry. I am the Young Adult Professional Chair, and I have or had sickle cell and lupus. So sickle cell is becoming more of a known name. I think we're trying to make it more of aware in the community or whatever. So that was one part of it, but I also have lupus, and that isn't always talked about a lot. And then for me, having those two diseases together was extremely rare. At the time when my parents were first looking at how to treat me, there was only one other girl in Texas that they ever knew of to have sickle cell and lupus together, who was currently living and going through life. So that was a really big challenge. I know that for a lot of us with rare diseases, it's a lot harder because with the flu or with the common cold, there are ways to treat it. There are ways that we can monitor things. We have a list of symptoms. We have a list of medications that we can take. We just have a way to understand it, even when we don't always understand it. And for rare diseases, it's more of a trial and error period every day. No one really knows what's going to happen. Sometimes we do have a couple of notes, or sometimes, if you're fortunate enough to find your community and find a way to connect with people who are going through things the way that you are able to talk with each other, communicate, discuss some of the things that you guys are going through. But I know for a lot of people, especially when they aren't able to get into different groups and things like that, it can be difficult because you don't really have answers to things that you wish you had the answers to. So now I just kind of work to advocate for those communities. I do a lot of stuff with Be the Match. And I also work with another organization. I can't remember off the top of my head, but we work just to bring a lot of these rare diseases to the forefront and make sure that they are also being included in our conversation. So Karen, to go back to your question, I think it varies person to person, but I have noticed that as I'm going to college and I'm branching out and I'm doing some more things, it is a question that I've been asking myself. How much am I willing to share? Yesterday, I was fortunate enough to go to an orientation, and right off the bat, I made like a lot of friends. We have like this freshman symposium, and we're all going to be with each other for the next like year or whatever. So they broke us into that group to try to get us to learn about each other and know that this is kind of going to be our base class. It's also going to be like our advisory period. So right after, we were like, oh, let's take a Snapchat and let's do all of this stuff. So it's awesome that I was able to start off with such a big portion of my life with a lot of good friends. But as I was driving home and as I was thinking about all of these things, I was like, what should I tell about myself? What should I explain? Who do I explain it to? I think I would definitely start with the roommate. I think that this is the person that you're going to be spending a year of your life with one-on-one. You're going to have friends and you're going to be able to go out and you're going to experience all of these awesome things in life. But your roommate is going to be like your sibling. They're going to be that person that you're with, attached to the hip at. Fortunately, if you do have a good roommate, I'm not sure about the other side of it, but the roommate is definitely an essential part of it. I think for campus living, there should at least be one person that you communicate with. You know, you have to have someone on board with you who understands what you're going through and will be able to be by your side through it all. Especially because when you're home, you have a support system, you have parents and siblings and even pets to a certain extent where you have a way to use your environment to cope. But in a new environment, you don't have those same crutches or those same, tools and materials to get through the things that you need to get through. So from my own personal experience, I think once you have found a friend and have found someone that you trust wholeheartedly and that you think you can communicate with moving forward, I think it's definitely important to be open and honest. And I don't think that you have to share everything right off the bat. I had a friend that I met while I was working, and he actually moved away recently. But I didn't share a lot with him until later on. And I think that was just because I needed to feel ready to share that. And I think that it's such an intimate thing to share with someone. It's such a close feeling to have. So overall, long story short, just find at least one person. And I think when you feel comfortable enough to discuss other things and you feel safe with that person and you know that they'll be there for you and you'll be there for them, I think that's an important time to open up, and only do it when you're ready, not because you feel like you have to.
I think that's so incredible and really helpful for so many people to know that they can reach out to somebody that, and they can do it on their own decision making. I would love to hear from Dr. Chang on the flip side of this. How, as a physician, do you tell people that they have a rare condition? You're talking with kids and parents and they come to you and, you run the labs and find this information. How do you share that information? That can be really tricky too, I would imagine.
Share the information with the child and the family.
Yeah, the diagnosis that they have this condition.
And also not afraid to tell them, I don't know what's happening. I may have to refer you to a geneticist, or it's a paradox. I feel like the more fallible or vulnerable I relate to the parents and the families, the more supportive they are of me as their doctor. And they're very forgiving if I'm not on the right track and I need to pivot and get back on track. So a lot of doctors don't want to do that. Don't want to show that they're human and they are fallible. And I actually think the opposite. I often will tell the parents, listen, I'm not 100% sure what's happening. I can refer you to another subspecialist or another cardiologist even sometimes. And it's interesting because when I say, maybe we could, I could recommend another cardiologist in another institution, and we can put our heads together. And this is who I will recommend. And it's interesting that when I offer that, 9 out of 10 times they say, no, we're happy with everything. We don't feel like we need to get another cardiology opinion. And it's interesting that when you're willing to say you like to recommend someone else, and they have more confidence in you, not less confidence, which is interesting psychology. And I'm very serious about getting another subspecialist to put his or her eyes on the patient. I think they like that about me. My family's they like the fact that I have no hubris or ego when it comes to taking their child, and I'm willing to call on anyone to get another opinion. So I think the families need that confidence in their doctor that they're human and they're not perfect, and it's a team effort, so.
That's remarkable. I love the team effort, because in rare, I think, we've heard from a lot of patients that have explained having that team approach is so incredibly important in, feeling like they're getting the best care, because there's not often a lot of literature or information out there about their condition. And so, to our youth members that are on here, if you're willing and able to share and you remember this, what was it like to hear the diagnosis? And maybe who talked to you about the diagnosis that you received?
I'd be happy to kick off a little bit, because I was thinking of what Dr. Chang was explaining and recommending patients to, say, a different specialist or anything. And I had that experience where I was diagnosed, and I also had doctors who didn't think that was my diagnosis. And my main surgeon who I worked with actually was not comfortable doing the operation I wanted. He was a fantastic doctor, but he said, you're a young person, and his success rate wasn't fantastic for the operation. And he was like, I'm not comfortable doing it. He's like, but here is a doctor who is renowned in it, and I know them very well, and let me send you to them. And I think that's one of the things I appreciate the most. I look back on it frequently when I think about it, because I think it could have changed things a lot. If he had done it, it might not have gone as well. Whereas when he sent me to a different specialist, it was such a wonderful experience. And for me, when I actually found out what I was diagnosed with, and when they confirmed it, it actually was kind of a relief for me to finally know what I did have, because I'd been told different things about what I might have had, and then it wouldn't add up, and then we'd have to switch the diagnosis. So when I had it confirmed with a series of tests, it actually was a relief to me. So it's sometimes I think it can be concerning, but sometimes it's a relief to at least know what you have, even if it might not be an outcome that you want.
I think that's a really good point. Having that knowledge is power. Being able to know what it is, give it a name, and be able to find the resources that can support you. That's a really big deal. Valeria, I see you shaking your head. Yes. Is that how you felt too?
So I felt my parents, my sister, and I have found it with the DNA test, because we have sent it to Hong Kong, and then we have the response that it was this syndrome. But this syndrome is very rare, and we are less than 1 billion. So, for example, in these years, there isn't a therapy or medicine for all the symptoms you have, but only singularly, just for one of the all. And also, we that doesn't have any research, because also for the many kinds of the sellers that are in the research, but also for the motive that we are less than 1 billion. And so we hope to find it very, very soon, but I don't know if our research will go on or if it will go on other diseases that are more known or that are in more numbers.
Yeah, that can probably be scary as a patient. Dr. Chang, what do you think about research funding for rare disease? Like Valeria just said, some of the funding might go on to diseases with bigger populations that more people know about. How can kids maybe help with creating more awareness?
I think they can help a lot by telling their personal story. I think the public and research organizations are very drawn to personal stories. And remember, it's probably 5 to 10% of Americans. So rare diseases has this unfortunate misconception that it's very, very few patients. If you lump it all together, it's actually a large segment of the population because there's so many rare diseases that are underdiagnosed or undiagnosed. So that's probably the biggest misconception that everyone can say all the time is I'm one of, I have a disease that's maybe 1 in 50,000, but there are a lot of other people with rare diseases also. And let's not single out diseases, but let's just constantly couple the rare disease with the fact that it's a very common situation to have a rare disease. And I think that does affect funding when everyone thinks it's a rare disease. So it's almost like we need to change the name because unfortunately, just by simply saying rare disease, people think it's too small a population. So I need to think about how we can rephrase or rename rare diseases because, and I loved, was it Rhiannon that told us that she has the combination? And I think that's also it's a rare situation to have 2 common diseases together. So just like I said, a rare manifestation of a common disease is in the same category. I think having 2 diseases should be also. Yeah, but it's a battle we have to fight. It's the misconception that it's too small a number of patients.
Mm-hmm. I agree. If we could come up with something more creative than just say rare disease, that used to be a tricky thing for my daughters with type 1 diabetes because they would say, it's not just diabetes, it's all these other systems that are affected by this. And so they wanted to break out and have its own name. So it wasn't, in the same category as other conditions. And so sometimes when science first starts looking at something, it gets a name for whatever the condition is, and it's probably the easiest one they can come up with, but it changes over time as they discover more things. So maybe that's something iCAN can do. Maybe we can come up with something creative to call this and see if we can get some more attention towards it. I love that idea, Dr. Chang.
Maybe we need to think of a few catchphrases like rare disease is not as rare as you think, or something along that line,
Yeah.
Just to get the fact out that it's 1 out of 5, 1 out of 10, or 1 out of 20 people. It's common. Or just rare disease is common, or something that will resonate with the public to have a different mindset about this. Yeah, how about rare disease is common? Maybe that can be part of the iCAN. I don't know if that's going to be a part of the iCAN program, but maybe
I love it. I think it's a great idea. We can start that at the summit. So we'll start talking about it and see if we can get it to catch on. Just takes a couple of us, right? That's kind of the
rare disease is not as rare as you think, or rare disease is more common than you think, or something that to dispel the notion that is false.
I like Reese just typed in not so rare diseases. I think
I
that's
like
kind
that.
of cool too.
Yeah. I like that, Reese. That could be a theme of one of the sessions, perhaps,
Yeah, I
maybe
like that.
Amy, we can add on as I said, rare manifestations of common diseases, and also what happens when you have two diseases simultaneously. So those are really good themes, and maybe have people with those situations. So my own daughter, Olivia, has an undiagnosed skin disorder. So I'm personally invested in rare diseases, as you can tell, not just from a clinician perspective.
And skin is so complicated, you know, it's an organ in itself. And so that's just tricky in general. Finding even the right, treatment pathway is so different for every single person. So that's another really big one that I think we just haven't studied enough yet. So hopefully you all are considering career pathways into research, because sometimes that also helps in having a young person who's very passionate about solving that puzzle, solving that mystery, and channeling their desire to move forward. I see Karen's got her hand up. Karen, did you want to jump in?
Yeah, it's a good segue for a question that was also mentioned in MI3 that I attended this week, which I get a lot out of attending. And Dr. Chang, you had mentioned error 1, 2, 3, I think, when researchers are doing research. And I was, a couple people were sending me articles, but I wonder if you could, since we're talking about research, if you could, in layman's terms, help us understand what that is, tied to research and diagnosis and stuff.
Remind me the context of what I discussed.
So it was, I'm not sure, but it was something in MI3 about research, and you were talking about errors 1 and 2, and then you mentioned 3. And I was asking in the chat, what can you help us understand? Help me understand what that is? So
okay, yeah, now I remember. Yeah. Type 1 error is when a test shows a patient has a disease, when in fact the patient doesn't. All right, and then type 2 is so that's type 1. So let me think of an example. COVID. Sometimes you have false positive from COVID, right? So when the test says you have the disease and that you don't have the disease. Does that make sense?
That's error 1.
Yeah. So
okay.
Error 2 is when when the test is saying that you don't have disease and you have the disease. So people think that the consequences of type 2 is worse than type 1, right? Because, well, it depends on what you do with type 1 error, right? So if you're tested positive for COVID and you actually don't have COVID, okay, so you sequester yourself, but there's no long-term consequences, hopefully. But if it's the other way around and you test negative for COVID, but you're actually in fact positive, and you're out there not wearing a mask, then you can create a super spreader event. So that's type 2 error. So type 3 error is when the study is irrelevant to the outcome. So in other words, you do a research project, but it doesn't really answer a relevant question at all. It's just basically a research project that has no impact clinically. So that's type 3 error, that you didn't ask the right question in the first place.
Super helpful.
Good.
All right. So I just saw there was some discussion about, thanks, Reese. I see that you just studied type 1 and type 2 errors in your data statistics class. That's funny. And I also just saw another comment from Mary Claire about Down syndrome, and the difference. I think it's a good maybe point to just clarify, and I don't know, Dr. Chang, this is putting you on the spot, but the difference between syndromes and disease state, if you have any clarification to that, you know, if there's something within rare that we are studying that's maybe different, or if there's some hope on the horizon for patients who live with a syndrome versus, having a diagnosis of a condition, or if they're the same. Maybe they're the same.
Well, I know that there's some overlap there. So a syndrome is classically defined as a bundle of symptoms or physical findings or lab tests that occur together, and it's called a syndrome. So Down syndrome has the typical phases, a certain set of conditions like congenital heart disease and thyroid disorders. So it's called a syndrome. In terms of medical conditions like diabetes, because it gets confounding, because a lot of medical conditions, as you know, and diseases actually have a genetic basis. So like personally, my father and my aunt had diabetes. So I know I'm at risk for diabetes. So I have to be careful about progressing to a point where I end up getting diabetes by, watching what I eat and all of that.
For type 2 diabetes.
For type 2 diabetes, yeah.
Mhm.
So, so it's sometimes you're born with a syndrome and you have everything that you're supposed to have, and other times you can have genetic predisposition to have something, but you may not develop the disease. So that's one of the differences, is that you can avoid some of the genetically inherited risks of having disease when you don't have the syndrome per se, but syndromes are typically more inherited as a bundle of things that makes it a syndrome.
Mary Claire, did that help a little bit? I think, one really wonderful thing about iCAN is that we are here as a support for all children from anywhere. So no matter what diagnosis or no diagnosis at all, we're here to support all kids from everywhere in the world. So if you have anyone who is diagnosed with something or not diagnosed with something, but they feel like they want to share and be a support to others, then this is the place for them. So we want to make sure we connect everyone. Good. I see your comment. Thank you. Okay, good. So just to go back to, go ahead.
I'm just going to say it does get confusing, especially for the public, because they look at the three words, right? Disorder versus disease versus condition even. So there are some differences, but there's enough overlap that it shouldn't be sort of be all kind of we shouldn't spend too much time trying to differentiate all these two, because then if you think you have a disease versus a disorder versus a condition, you may get confused and not just get good medical care and get follow-up. So I'm just like, with COVID is particularly relevant, right? Because there's a long haul syndrome of COVID, and people think, oh, COVID is just a temporary viral illness and they don't have anything. But they need to understand that it's, once you get COVID, you're committed to follow up for life for that, viral infection, which is not what you typically get with a cold or influenza. So people need to understand that while COVID, when you have COVID acutely, it might be a disorder or condition, I should say. But once you get COVID, the condition turns into, I think, a disease, in the sense that you may have long-term consequences of the disease, or at least you get follow-up to rule out the disease. So just because you have one, that doesn't mean that it doesn't continue to become another category.
That's a really powerful statement too, is not stopping because of language, continuing on to find the support and the care that you deserve. Everybody deserves the best care.
Yeah.
Let's see here. We just saw another one. I believe this is from Mary Rose. Well, my friend has epilepsy and she doesn't get out much, so I try to help her by making sure to talk to her as much as possible, just to let her know that she has someone to talk to. And I think that that's a really good statement. Rhiannon, maybe you could talk a little bit about peer support and how that has helped, and what the effect has been for you and maybe for other people you've talked to.
Yeah, so I think part of the biggest problem or the biggest thing we face in this community is that we feel undervalued. We feel that we're not heard. We feel that there are not a lot of people around us who can understand where we are, what we're going through. And so it makes it kind of harder to go through our daily life with these diseases. With that said, however, I do think that with a strong support system, it makes it a lot easier. And especially when you have people your age, as you said, peer advocates and just other people with you, it makes the situation a lot better. So I think that's one of the greatest parts about iCAN. As you said earlier, Amy, there is a collective group of people that come together with their diseases or without their diseases who are willing to stop and listen to each other. And I think the great thing about that is it's a safe place. And you don't even have to have the disease. You don't have to be in the same group. We don't have to completely understand every part of the medical treatment or the medical trial, but it's definitely a place for patients to talk to each other and just know that we understand. And while we may not have the disease, we may not go through everything that you go through, we know what it's like and we're willing to support each other along the way.
Can I just add something really quickly that popped out? I imagine, people who have caring, loving parents that can support them for rare diseases is so important. But I imagine there's a whole group of kids and parents being scared or fraught with anxiety around imperfection or something like that, that they don't know how to fully support their child who has a rare disease. And I imagine that there's a group of young people that have that scenario. And I just wonder, where do kids turn to when they don't have that internal support that's so important? And assume that it would be there, but I imagine it's not always there. So I wonder if anybody could address that. How do you approach that?
Yeah, I mean, I think it's really hard because sometimes as a young adult, you don't really know where to turn to. And if, for in this instance, you don't have the parental support system, it may be as though you are carrying the weight all on your shoulders. But I think as an organization like this, we just have to continue doing our job to advertise, to let people know that this is here, that this is a resource. And then also in schools and commonly known places, just letting people know that this is a thing. And then I think as individuals, I think as we go along throughout our day, we should always understand that we don't understand everything that everybody is going through. We don't know what's happening behind closed doors. We don't know how people are feeling. So in every situation, we should go through it with kindness and love and grace, and be supportive to all, even without the full knowledge. And I think if we continue to do that, there will be people who will come out and, say that this is how I feel, or, how do I get help? Or, you're so kind. How do I speak to someone? So I think it's just humans in general. We can just be kind, loving, and sharing, and just open the doors of our home, I guess, and iCAN to those groups.
And also a gentle plug for parent groups. Sometimes parents need resources to support themselves too. When you're having a family who maybe has medical needs, it can be challenging to figure out where you fit in as a parent. So we have a new iCAN chapter. It's been in existence, but it's kind of being relaunched right now with two parents who have children that were born in the NICU and had long, lengthy stays and some complications arising from that experience. And so they're taking on this new role of leading our chapter and setting up a parent council to help direct parent concerns and ideas and thoughts and feedback through iCAN. So more to come on that. It's available for anyone who might be interested, who needs to have that extra support. And again, it's a free service that we hope to provide to support that really important population of parents. So this is really good. I love that we've come together and we've talked about rare conditions. I wanted just to not really throw a specific question out, but if there's something that you really wish the world knew about a rare condition, and you'd like to leave us with that last thought, you can unmute and just go ahead and share it. You know, if it's something you've been wishing you had an audience to take this in, it would be great, because iCAN does have the power to help share your thoughts and your feedback, and it'll make it better for this whole group, but also for everyone who maybe isn't here today that needs that extra support. So feel free to jump in. I can kick it off a little bit with just a thought here that, you know, I love that Rhiannon said, you know, we don't have to have the same diagnosis, but that we walk parallel, with that we are together in this journey, is really powerful. So one of the things that I find to be super helpful, and Dr. Chang had talked a lot about this at the beginning of the session, is that together we are strong, and we are stronger than just one person out there by themselves. So, you know, we do a lot of projects through iCAN to help support that collective voice of all of us together. So you'll see I put a survey to the right there for Lyme disease. And while anyone on this particular call might not have been diagnosed with Lyme disease, you can help share perspective of what that pathway of treatment might look like to help kids who maybe have to have shots or, you know, might need more support. So that's why we do things like our survey. We want to make sure that we get that voice out there. Okay, well, it seems like we're kind of quiet now. So we are at the top of the hour. So I want to say thank you. We won't have a session for July because we'll be at the iCAN Summit. We will be posting the link out for the iCAN Summit soon. One happy note, Valeria, I think you might be headed to Rome, and I think Dr. Chang might also be going to Rome. So your paths might cross together with one of our doctors over at Bambino Gesù and Leanne West. So that'll be fun. Hopefully you can report back in August how that trip went and if you got to see each other. I think we would all love to hear that.
Yeah, I'm scheduled to be in Rome July 8th, Friday, and probably the weekend. So hopefully I can meet you in person.
Yeah, and I think Valeria is going to try to go over and give a little perspective of iCAN and talk a little bit for the I Spy crowd. So this is really exciting. And Rhiannon, you're going to be with Mary Claire and Mary Rose and Reese and Claire. We're all going to be together in Lyon. And I think Dr. Chang might be coming to Lyon too. So
I'll be here
be
the first day or two. Yeah.
Yeah. Yeah. So we will all get to see each other, which this makes our world much, much smaller too. It takes our big world down to something where we're much more close and neighborly. All right. And Karen, we will catch you up. We will have definitely good discussion about this. So thank you. All right. Well, have a great weekend. Thank you for sharing and talking about rare. And Rhiannon, thank you for opening up and giving us a glimpse of how strong you are and how inspirational you are. We really appreciate it. And Dr. Chang, thank you again for spending Saturday with us and giving us insight of being not only a pediatrician and a surgeon, but also as a dad and knowing what that journey is like from your perspective. Okay, thank you. Have a great weekend. Bye, everybody.